Assalamualaikum viewers, welcome back to my YouTube channel, and today we will discuss Paramyxovirus and the diseases that it causes. So through the picture memory, as you can see, this is the moon and a minus sign is shown over here, which reminds us that it is a single-stranded negative sense RNA virus, and it also replicates in the cytoplasm. And as you can see, these ghosts along with the envelopes, which reminds us that this is also the enveloped virus, and it is transmitted through the respiratory droplets, which reminds us कि यहाँ से हमारे पास पानी के कतरे जो है वो टपक रहे हैं. So this reminds us that it is transmitted through the respiratory droplets. And same as that we discuss for the rubella virus, the live attenuated vaccine is available for this, that is MMR vaccine. For this, the live puppet show is presented here to remind us, and also it is contraindicated in the pregnancy. So it causes the measles and rubella. So this guy, you can see, we will discuss it. In his quote, you can see that 4 C's are given, which reminds us that it causes the cough, conjunctivitis, coryza, and Koplik signs. Coryza is the rhinorrhea or the runny nose. Coughing is present and drippy nose along with red eyes, you can see in his present. And the blue berries in this jar, it represents the Koplik spots. These are the bluish spots on the background near the buccal mucosa or near the molars. And as the his face is sweating, so it also causes the fever of 104 degrees centigrade, and the maculopapular rash that starts from the head and it spreads to the body. It is basically a confluence rash. Confluence rash is represented by this solid dress which is wearing this lady. And the late complications it causes, that is pneumonia, and it's shown by this black type purse which is his wearing, and it is representing the lungs. So here you can see that the tails of SS Pence, it reminds us that it also causes the subacute sclerosing pain encephalitis. For this disease, we look for the anti-measles antibodies in the CSF. No treatment other is available. And this jar, it reminds us that it consists of the heme agglutinin. It causes the RBCs to stuck together. And this head, as it represents the encephalitis, and his hands are being stuck together, which reminds that the fusion proteins causes the multinucleated giant cells found in the lymphoid tissue, causes the red inclusion bodies. And here he is wearing a cat which represents the A. So vitamin A is given to reduce the mortality and the complications. It also causes the mumps, which is represented by this puffy person with puffy cheeks. Mumps जो है वो रेप्लिकेशन करता है इन द सेलिवरी ग्लैंड्स, एंड ये क्या करता है मेल्स के अंदर, इट कॉजेज द ऑर्चाइटस. इट इज़ रिप्रेजेंटेड बाय दिस यूनिलेटरल ऑर्चाइटस जो है यहाँ पे प्रेजेंट किया गया है, विच कॉजेज द इम्पेयर्ड फर्टिलिटी एंड द टेस्टिकुलर एट्रोफी. नेक के अंदर एक बड़ी सी ब्रेस शो की है, विच रिमाइंड्स अस दैट इट कॉजेज द मेनिंजाइटिस. एंड एज यू कैन सी दैट दिस इज ऑल्सो एंजॉइंग this live puppet show. So MMR vaccine is also available for this, and his hands are also stuck or joined together, so the fusion protein, neuraminidase, and heme agglutinin is also present. Now coming towards this tombstone, which represents the respiratory syncytial virus, and ये क्या करता है, it attaches the G protein to the infect the respiratory epithelial cells, which is given by this baby which is holding the G protein. And ये जो हमारे पास डिजीज़ है इट कॉजेज द ब्रोंकियोलाइटिस एंड नमोनिया विच इज़ शोन बाय दीज बेबीज़, और इन बेबीज़ के लंग्स को आप देखिए तो वो बहुत ही प्रोमिनेंट शो किया गया है. सो दिस रिप्रेजेंट्स दैट इट कॉजेज द नमोनिया. एंड एज इस बेबी को आप लोग देखिए तो इसके हैंड्स भी हमारे पास स्टक हुए हुए हैं. सो इट रिप्रेजेंट्स दैट इट ऑल्सो कंटेन्स अ फ्यूजन प्रोटीन दैट कॉजेज देम टू स्टिक टुगेदर. And for treatment of the respiratory syncytial virus, as you can see that the ribs are shown. So ribs reminds us for the ribavirion, and this guy is basically yellowish and holding a yellowish ball. So palivizumab, which is a monoclonal antibody, it is also given for the respiratory syncytial virus. Now coming towards the last disease, which is the parainfluenza virus, which is present outside this window, and it causes the seal bark cuff, which is represented by this black shadow animal. It causes the seal bark cuff, and there are the three virulence factors which are represented by the three wolves. Three virulence factors कौन से हैं? Neuraminidase, hemagglutinin, and the fusion proteins. And steeple sign on the radiographic X-ray is shown, which is shown by this stipple on the house. So this reminds us that the steeple sign on the X-ray is shown by the parainfluenza virus. And croup and the inspiratory stridor. This is the classical feature of this parainfluenza virus, which is shown by this outdoor door through which the air is going in. So this reminds us that it causes the inspiratory stridor, which lately goes to the laryngotracheobronchitis. So here ends the Paramyxovirus. Like, subscribe and share with your friends. See you in the next video. Allah Hafiz.